All right, pharmacist interventions part 8. The other day I had a 7-year-old prescribed 40 mils of amoxicillin twice a day for 10 days. That's 40 milliliters. That's a lot. It was the 400 per 5 concentration, which is well above 6,000 milligrams a day. So this was for an otitis media or an inner ear infection. We dosed that with high-dose amoxicillin treatment, which is 80 to 90 milligrams per kilogram per day, and we divide it up. So the dosing, I guess, was correct because the patient, because it was done based off of the weight. However, the provider did not take into consideration the maximum dose of amoxicillin you can give a patient a day, which is about like 3 grams or 3,000 milligrams. So it was brought to my attention because the office left me a voicemail and they were asking if that dose was correct. So it wasn't, so I inactivated the prescription so we didn't accidentally fill it. And then they sent in the correct dose for the patient, which was much less than 40 mils twice a day. So another interaction that I sometimes make, or intervention I make, is with patients who are on macrobid or macrodantin prophylactically for a UTI. I sometimes mention it to patients who are taking it every day long term. If you do take it long term, it can cause pulmonary fibrosis. This is more so for patients who are on it for like years. So it is something that I like to make patients and providers aware of. There are other safer alternatives for prophylactic therapy, like maybe Keflex or Bactrim. But I do bring that up sometimes. I had a patient who was picking up Gemtesa, and it flagged in the system that they recently picked up Mybetriq. So both of those are beta-3 agonists. They relax the detrusor muscle. They're for overactive bladder. And the patient asked me if Gemtesa caused dementia. And I said, well, no. She said, well, my provider switched me from Mybetriq because he said it caused dementia. And I was like, well, it doesn't. I don't know why the urologist told you that. They're both in the same drug class. He was thinking of anticholinergic medications, something like Benadryl or oxybutynin. Some medications can cross the CNS, get into the brain, and block cholinergic receptors, which are shown to increase risk for dementia. So I had that conversation with her about how Mybetriq and Gemtesa or mirabegron and vibegron are in the same drug class. They don't act on cholinergic receptors. I printed the drug monographs for her and then put her at ease. Another intervention is I had a patient prescribed U500 insulin. It's a very concentrated insulin. It has 500 units per mil versus normal 100 units per mil of insulin. It's for patients who are incredibly insulin resistant. You have to be very particular with the dosing, and you need specific syringes as well. So the instructions on the prescription were just yes. I don't know what that meant. So I sent a note back to the office, and I was like, please clarify the instructions so I can tell the patient how to inject the insulin. So it's very important to have proper instructions on that. I'm not sure why it said yes.